If you've experienced L4 or L5 disc bulges or disc herniations, you were probably diagnosed via MRI for some type of condition, pain, maybe it was radiating down one leg to the calf or to the knee or all the way to the foot. If you've experienced this, you know how debilitating spinal injuries can really be, and even sciatica. But a pinched nerve has more to it than you expect. A pinched nerve is usually because of soft tissue, swelling, inflammation, ligament injury, muscle spasm, and the disc bulge or disc herniation. It all starts with fatigue of the soft tissue around the annular fibers around the disc. And what ends up happening as we age, unfortunately, is the fibers can become more and more stiff and more susceptible to breaking or cracking. And that's where the disc fluid can actually penetrate and go through and enter into the spinal canal. Now, as a circular three-dimensional disc, as we have in our body, a herniation that goes anterior or forward may not cause any symptoms. I find these patients to be lucky. They don't even know they have a disc bulge or disc herniation until they get an MRI for something else and they say, hey, by the way, you have degenerative disc disease and some disc bulging in your low back. And people are like, wow, I didn't know that. But for the rest of us, what ends up happening is we get some type of symptom. And that's because the disc herniation went to the side or to the back, into the spinal column where all of the nerves are. And when that starts to happen, that's where all the symptoms come from. And by understanding the anatomy of the spine and knowing that there's lots of soft tissue around it, from ligaments, muscles, fibers, annular fibers, disc material, bone, and capsules, we could talk all day about the anatomy of the spine. But by knowing that, we can then know how to treat it. And each patient that comes in is very different. What ends up happening is that whatever the method of the injury is, typically it's from lifting something heavy, maybe going to the gym, a car accident, a sports injury, something that's physically straining on the spine. Other times, it's not that easy. Sometimes people come in and say, I sneezed, and all of a sudden, I've had pain ever since. And then the ortho took an MRI, and now they say, I need surgery. Now, when we go down that route of medicine and MRI, the only options there are pain management and surgery. And that's what this video is all about, teaching us a little bit more about L4, L5 disc herniations and bulges and what the true options are. You can resolve this naturally. And that's how we do it here at our office, is because we know what we know that inflammation is usually the driving force of pain. So what do we do for inflammation? Well, it's not just NSAIDs and prescriptions. What we want to do is organically try and get the inflammation down. And we do this by stretching the spine. There's two ways to do this. Physically stretching it through stretches that we can teach you on the floor in physical therapy, or we can use a flexion distraction table, which slowly and rhythmically lifts the legs up and and brings the legs down, flexing the spine to slowly get movement in there. These are for our patients that are in a lot of pain. They come on in, they're like, you got to help me. I got to do something. We get them on there first. Then we can use lasers. Lasers are great, class 4 lasers, because they help stimulate the inflamed areas and the water and the edema that's in there, and helps push it away through the vascular system. So when you use a class 4 laser on a particular area, it vasodilates the veins and the arteries to help fluid move in and out of the area. And then it also pushes edema out. It forces them into the capillaries and out, which is great. Immediately takes pressure off the nerves and reduces pain. That combination is a great way to help people at the very beginning. Laser also stimulates ATP in all the cells, bone cells, ligament cells, muscle cells, even the disc cells. And what that does is speeds up regeneration, your body's natural regenerative properties. And by doing that, you bring your body's own stem cells to the area. Now, if you're 20 years old, you have lots of stem cells. If you're 45 years old, you have a few stem cells. If you're 80 years old, you may not have that many stem cells. So healing is progressive based on our age. So we try and get patients to heal as well during that time. Then nutrition is next. So for a lot of people, they have to have some supplementation to that as well. And this literature shows that discs are really, when I went through medical training, what they taught us was that the discs were the shock absorbers to the spine. That is no longer correct. It's funny how science changes over time the more that we understand anatomy. And what they all are spacers. They're literally spacers. The shock absorbers of our spine are the natural curves that we have on our spine. So from a side view, we should look like an S, and from the front view, we should have a relatively straight spine. That S-shaped pattern of the spine is what creates that slinky motion that shock absorbs everything that we do from walking, running, jumping, playing sports. That's the shock absorbers. The discs are literally just spacers. And we have to keep those spacers healthy so that the bones don't touch each other. It's not the issue that the bone touches each other, it's the space for the nerve. So if we narrow that space, we increase the susceptibility of the nerve being entrapped, and that's what causes pain. So at Full Life Chiropractic, we focus on all 4 dimensions of the disc and trying to help it. And what we do is try and get people away from surgery. Because once surgery happens, a discectomy is pretty easy. That's usually the go-to for a lot of orthos, is they'll go in there, cut the piece of herniated tissue, remove it, directly takes the pressure off the nerve, usually resolves a lot of the symptoms, and they preserve all the anatomy of the disc, which is great. But by cutting that, we leave a major gaping hole in the fibers around the disc, which can make it more susceptible to another herniation later. If it goes further in surgery, where we start to do laminectomies, we remove part of the bone, or maybe we even start to put screws in and plates to fuse it into place, or even completely replace the disc now, they can do that. Then we now change the biomechanics of that area forever. And our goal is to try and get patients not just out of pain, but as resolved as possible. And there's many complications that can happen with spinal anatomy. We can also have slipped disc, which can cause stenosis inside of the spinal canal as well. And when we get stenosis, now we add a 3rd dimension of complication to it. But what we do is with the flexion distraction, with chiropractic techniques, anterior adjusting, which is very different. You're face up for these low back adjustments. Most people don't experience that, and the tables drop to help shift the spine. And with nutrition and our spinal decompression medical machine, that can create a lot of pressure within the spine and helps create a vacuum or reverse pressure inside the disc, which opens it up and pulls nutrients into it. So the combination, some people need all 4 therapies, some people use 2 therapies. It all depends on the complication of the disc, and that's what we focus on here at our office. If you have questions about specifically L4 or L5 disc herniations, the L5S1 disc or the L4, L5 disc, you've come to the right place. We know what we're doing here. We've been doing it for almost 20 years, I have at least, and I bring my expertise to the area to help people resolve these without the use of surgery.